Hi, my name is Lindsay, here to discuss my evidence-based practice presentation. The purpose of this paper is to be able to investigate an impact of nurses working 12-hour shifts and patient care outcomes and see if there's a direct correlation between nurses working 12-hour shifts through nurses working 8-hour shifts. Shift patterns may have an effect on patient-centered care and care continuity. This paper wants to evaluate articles and studies designed through nurses working long-hour shifts and seeing if there's an impact for patient care satisfaction. Does working 12-hour shifts compared to 8-hour shifts as a registered nurse impact nurse and patient satisfaction? The P for PICO stands for nurses working 12-hour shifts. The I is to study evaluating 12-hour shifts and 8-hour shifts and patient outcomes. The C is comparison between shorter and longer nursing shifts. And the O is improved patient outcomes and satisfaction. The literature search database is EBSCOhost. The PA College Library search engine is basically what I used. I typed in nurses that work 8-hour shifts, nurses working 12-hour shifts, impact patient care, nurses and burnout relating to patient care. I just typed in a whole bunch of stuff along those guidelines to see what would come up. I had to edit the search engine to have the articles within the past 5 years, had to make sure they were peer-reviewed. I had to make sure they were actual studies, qualitative and quantitative, I used to type in my search engine. This made it relatively easy. This class had a lot more detail into the articles and researching the articles and evaluating the articles, more so than any other class I've taken in this BSN program. But searching for appropriate articles were relatively easy for me since I've had to do this throughout the BSN program. The literature that was reviewed included 5 articles. They reviewed 12-hour shifts as a registered nurse working in a hospital setting and a correlation between a decrease in patient safety, nurse burnout, and job dissatisfaction. The study conducted by Battle and Tebbit assessed patient outcomes and level of care during incidents and outcomes using levels involving burnout, sick rates, personal injuries, and staff training. The study through Ball, Delora, Griffiths, and Simon analyzed an association between nurses' shift length and nurse outcomes using generalized linear mixed models through a cross-sectional survey. The data was collected from 12 different European countries. The Mullen and Room article measured sleep from nurse participants using actigraphy, which is a device that's worn on the wrist to record movements. So sleep diary was also used by the participants that used a sleepiness scale and sleep subjective parameters to evaluate a correlation between long work hours and any errors made involved with patient care. A study by Bailey and Thomas was based on 2 geriatric wards in an acute hospital in England. One ward had piloted the 8-hour day shifts over a 6-month period of time, while the other ward had 12-hour day shifts. The study by Anderson, Goldston, and Mueller conducted an interview process of nurses and nursing assistants that were analyzed by interpretive phenomenological analysis. The first bullet point article states that there are no significant differences in outcomes relating to patient and nurse satisfaction between nurses who work 8 hours and nurses who work 12 hours. In comparison, the article by Mullen and Room also stated that there are no differences in cognitive errors between nurses working 8-hour shifts and nurses who worked 12-hour shifts. The Ball et al. Study, in contrast, stated that nurses who work 12-hour shifts are associated with negative adverse outcomes that pose high safety risks for patients and nurses themselves. Bailey and Thomas' article concluded that there is no evidence that the length of a nursing shift of either 12 or 8 hours affected patient care of nursing staff communication with patients and families in comparison to the Ball et al. Article. In comparison, the article by Battle and Tablet have shown no significant differences in any of the outcomes analyzed when comparing nurses working 8 and 12-hour shifts. The qualitative study by Anderson et al. States that overall reduced work hours appeared to have many positive effects in both a nurse's work and at home life. The York Hospital has flexibility with nursing staff that have several different shift lengths, that have 8-hour shifts, 10-hour shifts, 12-hour shifts, usually based on the department, to allow staff to choose what works best for them during the application process. As a nurse working in a hospital, you know what you're signing up for, whether the floor only offers 12-hour shifts or 8-hour shifts, etc. Newark Hospital has a nurse resource team that was put into effect to help staffing issues if a floor is short-staffed, to improve patient ratios, which ultimately improves patient outcomes and decreases nurses' stress and burnout. This has just been implemented several years ago to help patients and to help nurses. Committees have sent out surveys to their nursing staff to evaluate burnout, preferences of shift, shorter or longer shifts, staffing issues to help build up nurse retention rates. So a lot of this has been done to help keep the nurses on the floors that they are working on, to help keep the nurses satisfied, to also help keep patients satisfied and have patients under great care and to not put them at risk. So a lot of these articles supported evidence that the length of nursing shift does not directly affect patient safety and care. The issue that can affect patient outcomes and nurse burnout has something to do with the lack of staff members actually present and not necessarily the 8 or 12-hour shifts. Some of the articles differed in affecting patient safety and care for 8 and 12-hour shifts, but for generalized statement, most of the articles had the conclusion that the 8-hour shift versus 12-hour shift did not effectively direct patient care and safety. But allowing nurses to have a say in their length of shift versus 8 and 12 hours does improve a nurse's work and home life. The articles have mentioned that nurses who do work the 12-hour shifts know what they're signing up for and understand the risks and benefits of the shift length and how it can affect their daily performance at work. These are the references I used. Thanks for listening.